As we age, staying on top of our health becomes more important than ever. But here's something surprising. Not all health checkups are beneficial after the age of 70. In fact, some of them may actually do more harm than good. Yes, you heard that right. Routine tests that were once useful when you were younger can sometimes become risky, invasive, or even unnecessary after a certain age. They may lead to anxiety, false alarms, overdiagnosis, and in many cases, treatments that carry more side effects than benefits. So, how do you know which test to skip? How do you protect yourself from medical procedures that might not be helpful anymore? In this video, we'll uncover 5 specific health checkups that seniors over 70 should avoid or reconsider, especially when you're otherwise feeling healthy and stable. We'll explain why these checkups may not be worth it, what the latest research says, and most importantly, what you can do instead to stay healthy without falling into unnecessary medical traps. Make sure you watch until the end. Number 5 is one that doctors rarely talk about but can significantly affect your peace of mind and even shorten your life if misused. Let's begin with the first checkup you might want to cross off your list. 1. PSA, prostate-specific antigen test. When more is less, the PSA test is commonly used to screen men for prostate cancer. It measures the level of a protein produced by the prostate. In younger men, it can help catch prostate cancer early. But after age 70, the story changes. What's the risk? According to the U.S. Preventive Services Task Force, routine PSA screening after age 70 is not recommended.
Why?
Because most prostate cancers found in older men grow so slowly that they're unlikely to ever cause serious problems during a man's lifetime. However, once a high PSA is detected, it often triggers a cascade of unnecessary procedures, like biopsies, MRIs, and sometimes surgery or radiation. These treatments carry major risks: incontinence, impotence, infections, and hospitalization, all for a cancer that may never have harmed you. The overdiagnosis problem. Research shows that for every life potentially saved by PSA testing, dozens of men may suffer serious side effects from treatment they didn't need. This is called overdiagnosis. After 70, many doctors believe it's better to monitor prostate symptoms than go searching for hidden issues that may never become dangerous. What to do instead? Talk to your doctor about your symptoms, not just your test numbers. If you're symptom-free, consider active surveillance instead of aggressive treatment. Prioritize a healthy lifestyle that supports prostate health. Reduce processed foods, stay physically active, and keep your weight in check. Point 2. Colonoscopy. Unnecessary risks. After 75, colonoscopies are often recommended every 10 years starting at age 50 to screen for colon cancer. They've saved lives, but after age 75, the risks start to outweigh the rewards. What's the risk? A colonoscopy is an invasive procedure that requires heavy sedation, full bowel preparation, and carries risks of bowel perforation, severe bleeding, complications from anesthesia, hospitalization. These risks increase with age, especially if you have other chronic health conditions like diabetes, heart disease, or frailty. Do you still need it after 70? If you've had regular colonoscopies with normal results and no family history of colon cancer, your chance of developing aggressive colon cancer is quite low. The U.S. Preventive Services Task Force recommends against routine colonoscopy screenings after age 75 unless there are specific reasons. What to do instead? Use non-invasive stool tests like the FIT test annually, which can be done at home. Watch for new bowel symptoms, bleeding, unexplained weight loss, or major changes in stool habits. Eat a high-fiber diet rich in vegetables, whole grains, and fruits, which naturally protects your colon. 3. Mammograms. When they cause more anxiety than safety, mammograms are vital tools for detecting breast cancer early in women. But after age 75, especially if you're healthy and have no history of breast cancer, they may not be necessary. What's the concern? Mammograms can detect very early or slow-growing tumors that may never become life-threatening in elderly women. However, once these are found, they often lead to biopsies, lumpectomies, radiation therapy, chemotherapy. These interventions can be physically and emotionally draining, especially when the benefit of removing these cancers is minimal. False positives and stress. Older women have a higher chance of getting false positives from mammograms. This means a suspicious result that turns out to be nothing after weeks of tests, fear, and anxiety. What the experts say. The American Cancer Society suggests that women over 75 should make mammogram decisions based on life expectancy and personal values, not just habit. What to do instead? If you've had decades of normal mammograms, consider stopping routine screening. Focus on breast self-awareness. Check for new lumps, skin changes, or pain. Keep discussing your health goals with your doctor, not just cancer risk. For full-body scans, a dangerous false sense of security, some clinics offer full-body CT or MRI scans as peace of mind, health checkups. They promise to detect hidden diseases before symptoms appear. Sounds good, right?
Wrong.
Here's the problem. Full-body scans can expose you to unnecessary radiation, detect non-threatening abnormalities, and often lead to unneeded biopsies, surgical procedures, hospital visits, anxiety from ambiguous findings. They frequently find benign cysts, scars, or age-related changes that doctors feel obligated to investigate, even when they pose no real threat. No proven benefit. There is no scientific evidence that full-body scans in healthy people increase lifespan or reduce disease risk. In fact, they often create a domino effect of tests, costs, and treatments that can do more harm than good. What to do instead? Stick to targeted checkups based on your symptoms and personal/family history. Practice a proactive lifestyle, balanced diet, daily movement, adequate sleep, and stress management. Avoid clinics or wellness centers offering expensive packages with no medical basis. 5. Bone density tests in the frail elderly. When it's too late to matter, bone density scans, DEXA scans, help diagnose osteoporosis and assess your risk of fractures. They're useful for many seniors, but not always for everyone over 70. The issue: if you're already frail, have suffered falls, or have multiple chronic conditions, a bone density test may not change your treatment or lifestyle. It can label you with osteoporosis, leading to medications like bisphosphonates or hormone therapies that may upset the stomach,
Cause bone or jaw pain.
increase risk of fractures in rare cases, lead to anxiety about falling. Treatment doesn't always help. For many older adults, especially those in their late 70s or 80s, strengthening muscles, improving balance, and preventing falls can be more effective than chasing numbers on a bone scan. When to skip it? If you're already taking calcium, vitamin D, and doing light exercise and you're not mobile or likely to undergo surgery, the scan might not add value. What to do instead? Focus on fall prevention. Install handrails. Use walking aids if needed. Avoid slippery rugs. Eat foods rich in calcium and vitamin D. Dairy, leafy greens, fish like sardines and salmon. Do gentle weight-bearing exercises if physically able. Getting older doesn't mean you need more and more tests. In fact, after 70, the goal of medical care should shift from early detection at all costs to quality of life, comfort, and informed decision-making. Here's what you should remember. Some tests are better left behind after 70. Overdiagnosis can lead to overtreatment, which reduces, not improves, your health. Not all screenings lead to better outcomes. Sometimes they steal your peace of mind. Always discuss your test options with a trusted healthcare provider who understands your goals, your life expectancy, and your personal preferences. Health is not just about what tests you take. It's about how you live each day. So instead of chasing every possible disease, focus on what keeps you vibrant: real food, real movement, real connection, and a calm mind. If you found this video helpful, don't forget to like, share, and subscribe for more senior health insights. Leave a comment below and tell us which checkup surprised you the most. Stay informed, stay empowered, and most importantly, stay well.